I will get us started with a reflection. This is one of my favorites. I may have used it here before. I want to apologize for that because I think it's a good one. But sit back and take this one in. It's called Be Thankful. Be thankful that you don't already have everything you desire. If you did, what would there be to look forward to? Be thankful when you don't know something, for it gives you the opportunity to learn. Be thankful for the difficult times. During those times, you grow. Be thankful for your limitations, because they give you opportunities for improvement. Be thankful for each new challenge, because it will build your strength and your character. Be thankful for your mistakes. They will teach you valuable lessons. Be thankful when you're tired and even weary, because it means you've made a difference. It is easy to be thankful for the good things. A life of rich fulfillment comes to those who are also thankful for the setbacks. Gratitude can turn a negative into a positive. Find a way to be thankful for your troubles, and they can become your blessings. All right. So this morning, we talk about our hearts. I know we've probably all heard the statistic, but every time I hear it, it's pretty striking. 25% of people, of us, will fall victim to heart disease. 1 in 4 people die of heart disease. I think that's pretty remarkable. So just looking around the room, you can touch someone who will be affected by this. So it's a pretty significant deal. And there are a lot of different contributing factors to heart disease. We hear about these on a regular basis. One of them that we hear about a lot is food in our diet, and what we put in our mouths and what we consume really does have an impact on our overall health and our heart health. And so Dr. Balderrama is here today. Dr. Balderrama is one of our cardiologists here with Ignesian Healthcare and SSM Health, and he's here to talk to us about that. Kind of dispel some of the myths, and is coconut oil really a healthy alternative, a cooking alternative? I think we've heard about that a little bit, but he's going to talk to us some more about that and hopefully impart some great wisdom on us. But if you could help me welcome Dr. Balderrama, I would appreciate that.
Thank you very much. Sorry, I think we're podiumless now, so you're going to have to bear with me with this table. So we'll go ahead and get started. My name is Tadeo Balderrama. I'm a cardiologist here, and I also have a background in nutrition. But I think more importantly, the reason why I'm giving this talk is because I love eating, right? Who doesn't? Food is such a huge part of our society. Particularly for me, I come from the area in Mexico that's very well known for its flour tortillas and anything else that you can think of that's really fatty. So I particularly picked this topic, I think, because of there's just so much misinformation out there. So I think it's a good idea to talk a little more about it. First, let's set some expectations. I can't make you an expert in 45 minutes. It's going to be impossible. I can't teach you how to eat in just 30, 45-minute session. This topic could take a whole year, a semester, a career. You just could not, in a short period of time, learn everything you can. And I just want to give you the most up-to-date information about foods and their evidence behind. And we're going to really focus on prevention. You can really go far and wide with this. Cancer prevention, aging, health, heart health, diabetes. So we're just going to try to focus on a small portion of that. There's a lot of words on some of these slides. Please realize that I'm going to just be giving you the summary of the slides. These slides are just for use if you want to read them at a different time. There's a little bit of a catch here. We are really bad at understanding how food affects our health. There's really been this search for a silver bullet, right? A pill that fixes everything, a medication that fixes everything. We're really looking for a solution after the problem takes hold. So the data here is a little challenging sometimes. And nutritional studies are expensive, right? I mean, who's going to give you food three meals a day for decades to see how it affects your health? So they're expensive. They take a lot of time, and they're full of potential problems. The way we studied is with questionnaires saying, what did you eat a week ago? I don't remember what I ate 2 days ago, but some people tend to remember it, and they log it. The food kinds that are studied, whether or not we study a supplement that we extrapolate to the food, or whether or not we study the actual food. And then healthy user bias. By nature, it's usually the healthy patients that want to participate in the trials. It's not usually the unhealthy patients. And so naturally, they're going to have some other healthy activities and healthy things that they do that's going to affect the overall outcome of the study. And then the potential benefit is still understood. If you want to talk about foods, really, we don't study the food itself. We study usually an extract or some sort of substance within the food. So we still don't quite understand it fully. But I think we're getting there. We're getting better. mentioned earlier, heart disease, really the top cause of death with 165 deaths per 100,000 in the population for the most recent CDC data. That's more than all cancers put together. And if you look at it, we don't really quite, I don't know that we necessarily grasp that, because most of our search terms on the internet are cancer, really driven, cancer, suicide, car accidents, diabetes, and even when you look at what the news sources report, heart disease is this sort of small little slip of things. So I think we recognize that heart disease is prevalent. We just don't recognize it as the leading cause of death. I think, and that's an important part. And so I promise to not include a ton of sciencey slides, but I think more importantly is that we start seeing these changes in our teens. When you look at autopsies, some 14-year-olds, 15-year-olds already start to have these fatty streaks in their arteries. And really, this is the presentation. This is when people start having issues, when people start needing medications, the cardiologist, the stress test. This is where it's at. And so I think the majority of our research has been really focused in this late period and not a lot up here. And our prevention strategies really function best up here, right? I mean, this is where you want to prevent things. Here, reversing is a little more challenging. So, and we see it on a daily basis, right? How many people get emails like this? Fat burning foods, base weight loss foods, sleep, speed up your metabolism, 10 super nutrient dense foods, right? You see it all the time, every time. And you see it at the store, right? Sugar, fat-free, 15 calories per tablespoon. I mean, really? Or for example, tricks, whole grains. And I don't know how much sugar is in these, but I'm assuming it's a lot. And same thing with chocolate Cheerios. So, and you even get these emails, right? I mean, we've all gotten them from random people that state, things like, drinking water can prevent heart disease. Take your aspirin at night because it can prevent heart attacks. And this actually even quotes a doctor from the Mayo Clinic, specifically dates and even mentions some pretty specific things that make you think this is a legitimate email. But when you go to the Mayo Clinic, they specifically say, this is not us. We did not say this. This doctor did not actively participate in generating this email. So it's full. Looking for suggestions, advice, figuring out how to eat or how to change your diet is full of misinformation. So it's just a huge challenge. And so that's what I hope to try to help here. And then the other thing is we really, as a population, our government entities haven't really done a great job at sort of helping us how to eat, right? Learn how to eat. You look in 1916, there wasn't really much else. In the 1940s, they came up with this sort of food groups. By the 50s and 60s, they started saying, food for fitness. And then in the 70s, the food groups came up. In 1992, the food pyramid, which I think most of us remember, and then the My Pyramid in 2005, which became way more personalized. And I think it's a little difficult for people to follow. I think fortunately we know what's bad. Right? We know. We all know that it's the fried foods, it's the sugary foods, it's this saturated fats, the fatty foods, everything that panders to our taste buds, right? And we know, and not only from just us knowing that this is bad for us, but I mean this has been clearly studied, right? What do people associate with a southern diet, right? Taste, right? Delicious food, fried foods, flavorful, spicy. But when you look at the southern eating diet, it increased coronary heart disease by 56% over the course of less than 6 years. It actually was associated with a 30% increase in stroke, and associated with multiple other problems, right? Higher level of smoking, less activity, higher waist circumference or fat around the center portion of our body, which has been identified as a really bad marker. High blood pressure, diabetes, high cholesterol. Yet, this is what we tend to go to, right? The comfort foods. Always you're sad, something wrong happens, bad day at work. It's the comfort foods that we go to. And so what I'm going to do is I'm going to go through at least the data that I can find on some of the more, I would say the more popular foods or the more popular nutrients that I think I found among the population. We'll go through them. Now, this may seem like a lot. Like I said, we'll go a little fast. And this is relatively informal, so if any questions come up, just raise your hand. I'm happy to answer them. I don't really mind stopping. And I do believe that the slides are available to everybody. So if we don't cover everything, it won't be a problem. Yes?
Can you repeat what you just said about waist circumference?
So waist circumference. So the increased circumference around the waist or increased fat around the waist has actually been associated with worse outcomes. So higher chances of cardiovascular disease, higher chances of diabetes. So it's sort of the pear versus apple shape. The pear shaped, the apple shape is bad, but the pear shape is also found to be bad as well. So typically that rather than the whole body total adiposity or total fat, which is also bad, but really that increased belly weight is really what's found to be the worst. I don't know if that answered exactly.
It does.
Kind of tough.
Our wellness program used to incorporate that waist circumference measurement as part of our biometric screens, and we kind of away from that. Very unpopular.
Yep.
So there's some, as we systematize our wellness program, there's some question as, do we include that again or not?
I mean, speaking from a cardiology and nutrition standpoint, it's waist circumference that was always studied. BMI was never studied. It's not until recently BMI was increased. So I mean, your belt has some truth to it, right? When it goes up in size, there's some truth to it. So let's go ahead and get started. I think, do I see any? Let's go ahead and get started. So we'll do the omega-3 fatty acids, which I think are really popular. And we do use them as medication too, right? And they come from multiple sources. They can come from fish sources or plant sources. You have both EPA and DHA, which are the most common fish source or animal source fatty acids, and they stand for, and I wrote them up here, eicosapentaenoic acid and docosahexaenoic acid. So DHA and EPA will stay. And they have been found that higher consumption versus lower consumption, leading to higher levels of it in fat and blood, that's what was studied, not necessarily just the intake, was associated with lower cardiovascular death and heart attacks. And so this is actually, extrapolate to about for every 20-gram increase in fish per day, it decreases your risk of coronary death by 7%, which is pretty good, right? But the issue with this is that most studies really looked at concentrated fish oil, not the amount of fish you consume, because there's different levels of omega-3 fatty acids in shrimp, that there are in salmon, that there are in tuna, that there are in shark. And you can also have increased levels of pollutants and mercury, which is the other concern. Regardless, the AHA still recommends it. There's not great data for it, but they still recommend some modest reduction in mortality. So I think if you can eat a little more fish, it's helpful. Now it does, like I said, it does come from some vegetable sources as well. It can be it is present in leafy greens, walnuts, canola oil, soybean oil, and flaxseed oil in the form of alpha-linoleic acid. And this actually gets converted to DHA and EPA, and a little less efficiently, but it does. And then, so with this one, for each gram a day of increase, there's a 10% lower risk of fatal coronary heart disease. Again, it may seem a little small. It's lower quality data. There's some evidence that it, like I said, slightly decreases them. But overall, I think fish is still the most efficient way to get it. You still have to be careful because of all the other pollutants that fish can contain, mercury, and some other toxic substances. At the end of the day, I think increasing your intake of fish and plant is not a bad idea because it'll decrease your intake of other less healthier proteins and substances. So now we're moving on to vegetable oils, and there's been a huge sort of uptick in this coconut oil thing. I think I've seen it all over the place. And the problem is that tropical oils are really high in saturated fats, which are the bad fats for us. They are known to raise your cholesterol, and there's really no trial on cardiovascular disease outcomes with coconut oil. So I don't know where this whole thing with coconut oil came from. It may have come from the fact that Asian populations that eat coconut oil had no heart disease. The other issue is that they don't have any other source of saturated fats. So it's really tough to say, that coconut oil is the reason why they don't develop heart disease. And the other oil that I think is less popular, but is also similar to coconut oil, is palm oil. And that has actually been shown to increase coronary disease. I mean, you're talking about 33% higher risk of coronary disease against soybean oil and 23% higher against sunflower oil. So, I mean, palm oil has been in the news about the sustainability of it. I think some companies using it in their products because palms take a very long time to grow and leads to huge amounts of deforestation. But, I don't think we see it as much. We don't see it like the coconut oil in a jar and, at Walmart and a health food shop. And ultimately, at the end of the day, even the National Lipid Association said there's really no evidence of benefit for coconut oil. Actually, I would argue that any fat that's solid at room temperature is probably not a good idea. And then you move to the, I think some of the other more popular, I mean, you see, some of these corn oil, the canola oil, and the sunflower oil. Actually, corn oil was found against extra virgin olive oil to decrease your cholesterol, your bad cholesterol, more than extra virgin olive oil. The outcomes of it have not been studied, but it actually, let's be honest. I mean, a 10%, almost 11% versus a 3.5% decrease of bad cholesterol, favoring corn oil. I mean, that's pretty good. Even canola oil actually, was found to have some beneficial effects on cholesterol, but there's really, again, no outcomes, no cardiovascular outcomes. So we don't know how canola oil versus something else will help you. And this was all based on 31 total studies. So I mean, that's quite a bit of data. And sunflower oil also lowers your cholesterol, no cardioprotective effect, but it's still there. I mean, that's still way better. That's still better evidence if there was for coconut oil. Yet I think there's tons of people consuming coconut oil. And then we move to the extra virgin olive oil. Yes, which has really multiple trials that have shown that it lowers bad cholesterol, it increases good cholesterol. It has antioxidants and particles that help improve the function of this good cholesterol. And even a large Italian trial showed a 30% risk of heart attack, stroke, and death from heart causes in combination with a Mediterranean diet. That is something very important. So all these oil trials have not been by themselves. They've always been in combination with something else. All the extra virgin olive oil trials have been in combination with the Mediterranean diet. So I don't know that you can say for a fact that just eating extra virgin olive oil is going to save, decrease your chances of cardiovascular events. So definitely something to keep in mind. And at the end of the day, I mean, you do have to come to a conclusion after all this, right? It's a little depressing to see some of this stuff because you just don't know, which way you're going to go. But like I said before, solid fats at room temperature tend to be bad for you. And then liquid fats may have some beneficial effect, particularly when they're plant-based. But you can see that, even the all-vegetable Crisco that is solid at room temperature would be a bad idea for your cardiovascular. So now we move on to the bright foods. I think there was a huge increase in the amount of people taking. Yes, I'm sorry.
What about like coconut oil compared to butter?
To butter. So that's tough. I mean, that's an animal source versus a plant source. I don't believe it's ever been looked at. We will touch on dairy, which sort of covers all of the butter and everything. But really, I mean, butter is a saturated dairy fat, animal source fat, solid at room temperature. I think if I had to shoot from the hip, I'm going to guess it's going to have just as bad, if not worse. But I don't know that it's ever been looked at head to head. No problem. So we move on to the bright foods, right? How many people have heard this? That, blueberries, red cabbage, eggplant, cherries, all this stuff that's really dark and purple is super healthy for you. I mean, it's true. I mean, it does have some antioxidants, but it has been found that that these antioxidants have been found to sort of help overall, with health. And there's people that dedicate their whole career to this antioxidant and heart disease, and nothing's really panned out yet from that. In fact, the president of the AHA, who I know works at MCW, actually does this. This is all he does, antioxidant cardiovascular risk. And he's still yet to come with that one substance that can be proven. And then, the initial studies were found that really, high dose of these foods were associated with decrease in heart disease, cancer, and aging. And that's why people started eating all these blueberries and taking all these supplements. But then subsequent studies, multiple other really well-designed studies found that it was either neutral or negative findings. And so I think, I think the idea here is that maybe at low consumption, this may be helpful, antioxidants at low consumption, but once you start getting into really high supplemented concentrated levels, you may have some detrimental effect. Any antioxidant, and I use this phrase a lot with patients, any antioxidant too much, when you take too much of it, will become a pro-oxidant, which is bad. And it just proves the fact that too much of a good thing can be bad too. So I think with the bright foods, it was even looked at in some of these sort of larger studies, the Nurses Health Study, which was followed by I think 16 plus years, 60,000 or 40,000 people, and they did find that about 3 weeks, more than 3 servings a week of blueberries or strawberries had a tended decrease in heart attack. Again, you have to take this with a grain of salt. This was a questionnaire performed every 2 years for 16 years. So how many people remember how many servings of blueberries they ate a year ago? I don't. So I mean, I don't even remember how many blueberries blueberries I ate last month. But so you have to take it with a grain of salt here. And then for blood pressure, there was a trial that directly looked at a cup of fresh blueberries versus 22 grams of freeze-dried blueberry powder versus 22 grams of just an unknown powder, control powder, and it decreased your blood pressure by 7 points. Not a lot, but better than some of our sort of less known medications. And then with diabetes, it was associated with a lower risk of diabetes versus 1 serving a month. So eating more than 2 servings per week versus 1 serving a month. Again, I mean, the question is, are these people also eating a much healthier diet than the person that's not eating berries? And so at the end of the day, I think what I would say is that fruits and vegetables are the healthiest and most beneficial source of antioxidants for cardiovascular risk reduction. Yes?
For the blood pressure, how long is that? These people eat blueberries for months, or did they eat it 5 minutes before they came into their blood pressure check?
It was for months. It was for months. Yeah. So I mean, again, with all these, how long do you think somebody would give a cup of fresh blueberries a day to a patient, or to 200 patients or 300 patients? That's the challenge, right? I mean, you need a huge sponsor to be able to do that. And who's the sponsor going to be of this? It's probably not going to be the blueberry farmer. It's probably going to be the supplement maker, right? So yeah, I agree. You always have to be a little cognizant of those things. But so at the end of the day, fruits and vegetables, best source. I'm not all against supplements, but I think you have to be careful with your supplements. And so we're moving on to nuts. There's a huge, I think, uptake in the intake of nuts, and in particular with these that I mentioned up there. And they're good because they have a lot of unsaturated fatty acids, they have a lot of fiber, they have a lot of complex carbohydrates, so they make you feel fuller longer, so you end up eating less in the long run. The problem is that they're high in fat, they're really calorie dense, so that little nut may have more calories than a bowl of vegetables that you're going to eat on the other end. So they can lead to excess weight gain, and so you really have to be careful with your portion. Portions of nuts, if you look on the back of the can, I mean, they're pretty small portions. But think about how many you eat. I mean, you don't eat that portion. I guarantee I don't eat that portion. And they have been, associated with decreased risk of diabetes, whether that's because people eat less of the sugary foods and more nuts. Maybe that's what it is. But what they found is that 4 servings of nuts per week cause a 13% reduced risk of diabetes, and this was based on 6 total studies. Again, observational questionnaires. Nobody was giving anybody nuts and then measuring their level of blood sugars. And they can also improve sugar control in diabetics. Again, maybe it makes them feel fuller. They have more complex carbohydrates that take a little longer to digest, and they don't go straight to blood sugar. So maybe helpful in that instance. And then the way we've really studied them is, again, with the Mediterranean diet, right? I mean, it's really challenging to just break apart one nutrient and study it. But it does decrease metabolic syndrome, which is the syndrome where you have increased blood pressure, high blood sugar, excess body fat around the waist, really abnormal cholesterol panel. So I mean, that's helpful, but whether that's because of the nuts or the Mediterranean diet, it's a little more challenging to find out. And then, there's definitely been benefit, though, shown that when you eat more nuts, you have a reduced risk of cardiovascular disease. In the U.S., that's not been the case for stroke, to reduce the risk of stroke. But in Europe, they did find a 49% stroke reduction with nut consumption. And 30 grams of nut a day led to 30% or less cardiovascular disease, 30% less cardiovascular disease. So again, whether it's just the nuts, or is it that they have a great diet on top of the nuts, or they're following a Mediterranean diet, or they're exercising more, or not smoking, I can't tell you, but there's clearly been an association. And then we move to the green leafy vegetables, right? Everybody's favorite. Who here eats more than 3 servings a day of leafy greens? Probably nobody, because I don't. And my wife tells me all the time. But they are associated with reduced arterial stiffness and reduced blood pressure. And that's because of this nitrate, this inorganic substance that gets converted to a substance in our body that helps relax our arteries. They also have antioxidants and anti-inflammatory proteins, particularly lutein, which you probably heard is also in ketchup. So a lot of it in ketchup. They contain multiple other compounds that have been shown to be effective and good. Again, extrapolating, taking hundreds of compounds and try them one by one would take decades, if not, centuries, and I don't think we'd come up with a solution yet. They do reduce the risk of diabetes. They are higher in fiber, antioxidant content may lead to this insulin sensitivity, improved insulin sensitivity, meaning you need less insulin to have the same effect. And even when they looked at the Nurses Health Study and the Health Professionals Follow-Up Study, and I'm not sure if I mentioned it before, so the Nurse Health Study is a study that's been going on since the 80s, and they pooled, I think it was something like 60,000 women, and they send out a questionnaire every 2 years. And so that's this incredible amount of data that we've been following for, greater than 20 years. The Health Professional Study was physicians. I don't know why they separated them like that, but what we do now is we pool both of them, and we use all this data to make some extrapolations. So 110,000 men and women followed by 14 to 6 years, and they found that actually 3 servings a day of leafy green vegetables plus a low carbohydrate diet. I mean, you can't get simpler than that recommendation. And you have a 24% reduction in cardiovascular disease. I mean, we talk about the Mediterranean diet, we talk about DASH diet, we talk about the South Beach diet, all kinds of diets and changes, right? Eat more fish, eat less meat. I don't know that we can get any simpler than telling our patients this, right? Eat your vegetables and don't eat too many carbs, and you would have good outcomes. And I think this is a good segue to a plant-based diet, right? Which is really challenging in the U.S., where I think I've seen the sticker so many times, right? Where everything is meat and meat and Arby's. Arby's, we got the meats is their logo, or is their whatever it is, their catchphrase. And so it's interesting to look at these plant-based diets, because if you look at the Mediterranean diet, it is predominantly a plant-based diet, right? Yet we're telling our patients, eat a Mediterranean diet, but they go to, they go to a local restaurant, and there's not really a lot of Mediterranean options, right? Because everything is animal-based. It's just so much animal-based protein. When vegetables are in fact a good source of protein-rich foods, particularly legumes here, and they can contain just as much protein as animal sources. I mean, when you look at a cup of lentils, cooked lentils, you have 18 grams of protein without fat or sodium, right? As opposed to a 6-ounce steak. I don't know a place that serves a 6-ounce steak, but a 6-ounce steak has 40 grams of protein, but 12 grams of saturated fat, right? If you could separate it, that would be great, but you just can't. It comes together. And then there's been multiple studies that show benefit, right? Vegetarians in general have a 32% lower risk of coronary heart disease, and that was based on a European study of 44,000 patients. In the US, they have a lower rate of diabetes, lower rate of metabolic syndrome, high blood pressure, high sugars, fat around the center of the body, healthier weight, lower blood pressure, and actually, reduced rates of stroke. I mean, if you look, even when you meet some of these people that are in charge of some of these studies or in charge of making some of these guidelines in cardiovascular disease, the majority of them are following a plant-based diet. It's really funny to see this, and and even when you look at populations, right? Because we always try to look at one population and try to say, like, what did they uncover that they're living so long that we can use too, right? We always try to do that. In populations in Okinawa and Papua New Guinea, rural Chinese, Central Africans, Tarahumara, rarely have heart disease, but they also have a majority plant-based diet, and they don't really have sources of saturated fat. And you can even go, even sort of lower evolutionary than this and say, what animal develops coronary disease, right? I mean, no animal, because they have mostly a plant-based diet. Even when you look at our fellow mammals that eat saturated fats, they're not eating saturated fats 3 times a day. They're eating saturated fats maybe once a week. And so that's sort of a little bit of an issue that I have with things like the paleo diet, that it's not quite a plant-based diet when it should be. And then again, you even see improvement in those with active cardiovascular. So should we be telling our patients eat more lean meats, or should we be telling them just don't eat meats at all? Just eat vegetables. Just eat a plant-based diet. And in fact, a whole food plant-based diet actually showed decreased progression of coronary disease in patients with established coronary disease. And this was not based on extrapolation. This was literally people who went fully vegetarian, and they took them back to the cath lab and they looked at the arteries again. So it doesn't get better than that if somebody wants direct proof of something working. A little word about juicing, because I think a lot of people have tried to sort of increase their fruits and vegetables by juicing them and drinking them. The issue with juicing is that it concentrates your calories, right? And a lot of people tend to add sugars and other things in protein powders to sort of, to maybe make them taste better, or to believe that you're improving your nutrition. But there's not a lot of studies available, right? There's not a lot of people that have looked at juicing versus just consumption of whole vegetables. So it's really tough to recommend juicing for anybody, except for those that just don't have the daily intake of fruits and vegetables. Maybe kids would be a good example. But in general, taking whole foods away and using juicing, I would probably recommend against it for the time being. And then we move to gluten, right? I mean, who here hasn't heard that a gluten-free diet is really good for you, right? The wheat belly diet, I think there was a book published by cardiologist that practices out of Aurora, I think, that really sparked all this talk about, we should be eating less wheat, we should be eating less gluten, and everybody's trying to find a reason, right, behind this. And I think a gluten-free diet is definitely helpful in those with gluten enteropathy or with celiac disease, those that have approved allergy to gluten, and those people tend to be underweight, tend to have a lot of diarrhea, malabsorption of proteins because of their allergy to gluten. And those people, actually, a gluten-free diet can decrease the risk of dying or having complications from their celiac disease. There's still no data on cardiovascular outcomes in those patients. I think the more problematic portion is this non-celiac gluten sensitivity group. That it's estimated that about 6% of the population has it, and they don't quite have the same symptoms that a celiac disease has, but they don't feel good when they eat gluten, or they perceive not feeling well when they eat gluten. And even some people that have perceived weight loss with a gluten-free diet, right? I mean, there's really, again, no evidence that you're going to lose weight with a gluten-free diet, and in fact, you gain weight if you have celiac disease. So I don't think there's any evidence to suggest there's any heart benefit from a gluten-free diet. It may help you eat less carbohydrates, which would be good, but the problem is that it keeps you away from complex carbohydrates. And so there's this study on long-term gluten consumption. Again, nurses' health study, health professionals follow-up study, where they took about 64,000 patients over a period of 24 years. So I mean that's pretty solid. But you can see here, not significantly associated with risk of coronary disease. This is straight from their conclusion, and actually avoidance may result in lower intake of whole grains, which are associated with cardiovascular benefits. So again, I don't think that this is going to be the maximum solution, gluten-free. I think what we should be focusing on is sort of a different way. And now getting to dairy to try to answer your question, dairy is really confusing, really confusing. You see here no alternative to dairy. You see all the proteins, you see all the reasons why dairy is bad, and you should ditch it. And the problem is that it is the top source of saturated fat in the U.S. The studies, their quality, the interventions really vary. A lot of the studies are actually funded by industry, and they favored their funder, the industry. So again, I mean, whether or not you can trust it is really tough, and there's just been really inconsistent associations. What we do know, though, is that full-fat dairy is bad, and we should not be consuming it. And instead, what's been studied is this low-fat dairy. But even the low-fat dairy has some issues, right? I mean, at least we'll start with the positive result. In the DASH diet, which was developed, I believe, was in the Mayo Clinic, and it's just a plant-based, high fruits, high vegetables, low-fat dairy. It really showed a significant decrease in blood pressure in patients. Really easy to find, really easy to follow. It actually gives you, the exact servings of what foods you should be eating, and it's a little closer to an American diet, and it's a little, I think, easier for patients to follow, in my opinion. And then when they looked at the nurses' health study and the health professionals' follow-up study, they actually found they're replacing 5% of your energy intake from dairy fat with polyunsaturated fats, so extra virgin olive oil, omega-3 fatty acids, or vegetable fat led to a 24% decrease in cardiovascular disease, or 10% increase when you use vegetable fat. So again, it tells you high fat or full fat dairy, probably a bad idea. That's where the butter comes with butter. You can't really have low fat butter, unfortunately. And then the confusing part, though, is that replacing 5% of your intake from other animal fats with dairy actually increase your risk of cardiovascular disease. So again, this is why the evidence is really confusing. You just don't have anything specific there. And to make it even worse, there's evidence for and against bone fractures, breast cancer, ovarian cancer, prostate cancer, and death from all causes. So it's just really challenging. It's just really challenging to give you a one-liner of what you should be doing with your dairy intake. We do know, again, full-fat dairy compared to low-fat dairy is bad, and there's really not even among the experts, there's clear consensus. So the question as to whether or not you should be a vegetarian or a pure vegan and not even consume dairy fats, I don't know that we can necessarily answer particularly right in the dairy state. I don't think you can answer. I think I would be shot outside if I said there's no dairy. We move to legumes now, and those are nutrient-dense, low in fat, rich in protein, complex carbohydrates, and they have been shown to decrease the risk of coronary heart disease, but not stroke. Again, probably the fact that this is a plant-based diet, not necessarily the legume alone, but the fact that you're eating less of other animal sources, saturated fats. They can lower your blood pressure by 2 points and lower your bad cholesterol by less than 1 point, which is not really significant. And they can actually lead to some weight loss. So 1 cup of legumes a day can decrease your weight by about 3/4 pound. And they may be due to the fact that they make you fuller, so you eat less in general. And they're pretty affordable, sustainable source of protein. You can grow a lot of legumes in a small amount of land with a lot of energy invested. So when you look at some of these cultures that don't eat plant-based diet, this is really how they get their protein intake. So, and then coffee, right? Coffee's been all over the place. I think I've heard coffee is great for you, coffee is horrible for you, coffee is great for you again, and it's just really tough to make something of it. I think some people worry that it increases your blood pressure, and it does in the short term, but in the long term, it really doesn't cause any problems. In fact, a recent study found that 4 cups of coffee a day had an 18% lower risk of dying prematurely over the age of 16 years old versus non-drinkers. And even a cup of coffee a day was felt to have some benefit. Again, this is tough, right? Because it looks great on paper. It looks great on paper when you boil it down. But when you look deeper into this, questionnaire, European study associated with probably many other healthy habits. So it's tough to say that coffee in and of itself is going to save you from everything. And then in European studies, actually, they had a 7 to 12% lower risk of dying, which is a little lower than what we found here. And then more importantly, though, lower rates of digestive diseases and stroke. Again, I don't know how to pull that stroke out of that, but it's definitely there. And importantly, I think, it's really safe for patients with heart disease to continue drinking coffee. I think a lot of times we do tell patients, limit your coffee, don't drink coffee, but, that really hasn't panned out. It does, find that there is some evidence that, there's decreased risk of death, of heart death, of cardiovascular disease. There's even evidence that there's, 18% lower risk of cancer. Again, nobody really studied just coffee versus not with exactly the same diet side by side. So it's really tough for me to tell you that is for sure, that I can take that number to the bank. The one place where there may be a problem is in patients with heart failure. And those patients maybe it's sort of a little in between may be helpful, but if you drink too little or too much, it may lead to problems in the long run. And it's really not associated with increased risk of atrial fibrillation. This was based on a recent study. I think some people are sensitive. I think the go-to about this irregular rhythm is that some people are sensitive to it, some people are not. If you're sensitive to it, then don't drink it. If you're not, then you can continue consuming it at a moderate intake, right? Don't drink a full pot, but also just don't drink nothing at all. And you really always have to be careful with sugars and fats, right? Everybody likes cream in their coffee, cream is saturated fats. Some people like sugars in their coffee. That's also a problem. So. And then that brings us to tea, which for a while it was like tea is great for you. It's amazing. People consume tea, do really good, and you do see that daily tea consumption in a Chinese population of 500,000 associated with 8% decreased risk of heart disease from coronary causes and 10% decreased risk of major heart events. This may have been the same Chinese population that doesn't consume animal fats. So this is where you have to be careful here. And again, this is all based on tea without added sugar, sweeteners, milks, or creams. So not everybody. I don't really see the brisk, unsweetened iced tea in the cafeteria being used very often, right? not many people go for it. And I think we get to everybody's favorite and less clear alcohol, right? And you see this sometimes. Can it lower your risk of heart disease? And a cup of wine, right? And the Mediterranean diet does include a glass of wine, with meals. 1 glass of wine, not a whole bottle. And this is just really, really complicated, right? And it really varies by your age, by your gender, by your ethnicity, by your genetic predisposition to it, by how you consume it, by the form of the beverage. I mean, we know, or we found out at least, that less than an ounce, that's less than one drink, less than one 5-ounce glass of wine, a 12-ounce beer, or 1.5 ounces of liquor can actually decrease your cardiovascular risk, but even low consumption increases your risk of stroke, right? So, it's a little challenging, and we do find that heavy and binge drinking patterns increase your risk of multiple cardiovascular problems. So, I mean, it's really tough to recommend anything for it. And even in women, modest consumptions associated with an increased risk of breast cancer. This is by the American Cancer Society. And even the Institute of Medicine just came out and said, all alcohol is bad. Any alcohol consumption is bad, right? So in general, it's really tough to tell you that there's any benefits of alcohol. There is some data that hasn't really been of high quality, but that showed that high risk of falls, cancers, and liver disease. But it's not enough. The improvement in your cardiovascular risk is not enough to tell you to start drinking. And in fact, I think the recommendation would be that if you're not drinking, don't start. And if you're drinking, you should probably limit it. And maybe you only drink it with meals. So again, even when you look at the Mediterranean diet, it's 1 glass of wine with meals, either at lunch or at dinner, and that's it. But the weekends, I'm sure, don't look like that for a lot of us. And then fermented foods are coming up. And this was a really tough one because there's not a lot of information on fermented foods, and fermented foods can vary a lot, right? I mean, what you ferment, how you ferment it, what it contains, so it's really, really tough. I think the biggest thing that I found is that it's really the probiotic content that drives sort of the benefit in fermented foods. And in fact, when you look at fermented milk and yogurt, those were not actually tested. It was the probiotic that was tested. So we're just extrapolating from that probiotic data to the fermented foods. In some other cultures, though, they have studied kimchi, seaweed, and spirulina. Kimchi, which is a fermented cabbage. And it's definitely rich in some micro, and macronutrients. There was a small study that I was able to find that patients who consumed about 100 grams 3 times a day had a decrease in their weight, so about 3.3 pounds in 2 weeks, which is pretty good. And even their blood pressure by 5 points. This is despite the fact that this has a lot of sodium, but it also has a lot of potassium and other non-sodium minerals. So that may have been the reason why. But I couldn't find much else other than that on kimchi. On fermented milk and yogurt, again, probiotics alters your gut flora. There's some people that think that it's all in the gut, and it's all in the gut. It's on what we eat, and it may be true. And in fact, adding it to a regular diet did decrease your cholesterol. And receiving a probiotic over the course of 9 weeks, again, a probiotic, not fermented products, led to decrease in bad cholesterol and decrease in inflammation, which, again, we all think that inflammation is bad for heart disease as well. Then we get to a little bit of the weirder ones, fermented seaweed, which can promote you feeling full, lower your cholesterol, decrease weight, at least that's what's been said. The study that I found was 300 milligrams of extract, not the food, but the extract, again, led to a 5-kilogram weight loss, and that's about 5 kilograms. That's about 11 pounds. So that's pretty good. And it does have some bioactive compounds that function like blood pressure medications and can improve your insulin sensitivity. Again, never been studied, never been seen if they're truly effective when eaten. And then the spirulina, which I'm starting to see a little bit. I only found one study. It's a nutraceutical, which I think you'll see in a lot of infomercials nowadays. So that's a compound that gets extracted from food and put in a pill form, and it's felt to be like a medication. And it does have some cholesterol lowering properties, but nothing that I found that was significant. So in the end, not a lot of good evidence, not enough evidence to suggest routine consumption or eating it on time, from time to time, but really no evidence that it harms you. So if you like fermented foods, by all means. And then dietary diversity. I think a lot of us have heard this whole eat the rainbow, right? And I don't know what that means. I don't know if it means eat your fruits and vegetables or eat as much variety as you can. And I think it makes sense, right? From a nutritional standpoint, eat as much variety as you can. But when you really told people to eat as varied as possible, they tended to eat more. And they tended to have suboptimal eating patterns. And they actually gain weight. So, really, at the end of the day, you should be emphasizing eating patterns that have adequate plant foods, protein foods, low-fat dairy products, vegetable oils, nuts, limit sweets, and red meat. again, didn't pan out. And that's a really easy catchphrase to use, right? Eat the rainbow. And then we have the obvious bad players. I think I'm presenting all this stuff that's a little confusing, but I do want to present some stuff for the things that we do on a day-to-day basis that I think we know are bad, but we may not know how bad they are. 75% of foods in the U.S. have added sugars. And that mostly comes in the form of high fructose corn syrup or sucrose, with sugary drinks accounting for most of the intake. And even though we have decreased our amount of added sugar, it's still higher, about 25% higher than it was 250 years ago. In fact, and the problem is that some of these sort of more concentrated, sweeter sweeteners like fructose can be taken up regularly. So they can cause problems that we may not even know are being caused. So for example, fructose is taken up by the liver, so it causes more fat accumulation in the liver than glucose alone. And when they fed pure fructose to young adults, they essentially took away 25% of their energy intake and just gave them fructose alone for 2 weeks, and let the higher levels of the bad cholesterol than pure glucose. Again, not good, no long-term outcomes, but definitely not a good thing to have. And when you look at the health professional follow-up study, men at the highest intake of added sugar had a 20% risk of coronary heart disease than those at the lower intake. Again, maybe because of other bad habits, but you can't ignore the sugar. And we tend to forget, because sugar's in everything, but really the recommendation is less than 10% of calories. So less than 100 calories for women and less than 150 calories for men. If you open up those 100-calorie packs, you're probably going to meet most of, you've all seen them, right? At the store, 100-calorie Oreos or 100-calorie whatever. You probably are close to meeting this with just one of them. I mean, it's pretty interesting in my opinion. And then energy drinks. I don't think nobody says that energy drinks are healthy, right? But they do, pander that they have vitamins and caffeine and taurine and all this stuff. And the problem is that, they're in huge quantities. And because they were considered a soft drink, they weren't heavily regulated, and the FDA wasn't really looking at them, and they just started looking at them. But, especially when we found that it had an increased risk of rhythm abnormalities, coronary spasms, and dying, and specifically in young people. So, I mean, that's a really bad idea, right? And so the American Academy of Pediatrics actually came out and said nobody should be drinking these. And the International Society of Sports and Nutrition said, kids and adolescents should not be drinking this without parental permission. I don't know what that means. But so, while we have limited evidence and low quality, it does say that it may be harmful. So energy drinks are always a bad idea. So now that I probably put a lot of you to sleep early this morning and maybe depressed you with eating patterns, where does this leave us, right? And it's confusing. You look at all this stuff and you're saying, I've been eating really wrong my whole life. Right? I mean, should I be eating like this? Tiny little portions, very colorful, a big salad, even though there's a bowl of noodles up there. But should I be eating like this? But it's really tough to change your lifestyle, your culture, your day-to-day activities when food means so much to all of us, right? Food means family, it means community, it means friends, it means Thanksgiving, a large meal, dinner with friends, right? Always includes a glass of wine. So it's really challenging to say that you should completely change the way you eat. I think we should alter the way we eat. I don't think we should be seeking out these sort of rare substances that are going to provide us with the endless key to being healthy and not age. But I think we know what's good for us. We know what's good for us and we know what's bad for us. Yet we keep fighting it, right? High fruits, vegetables, whole grains, legumes, nuts in moderation, limiting lean meats, poultry, and seafood. You see that red meats is not even on here. Low-fat dairy products, liquid vegetable oils, and this alone, these tend to be low in saturated fats, trans fats, solid fats, sodiums, added sugars, and refined grains. So it's not very difficult. And even actually, interestingly enough, the VA has actually started to promote this too, rather than saying DASH diet or Mediterranean diet. They've changed how your plate should look. And granted, our plates are much larger nowadays than they were 40 years ago. But I mean, really, half of our plate should be vegetables, leafy greens, whatever it may be. Our starches should be whole grains. It should include some legumes that promote you feeling full. And protein should be much, much smaller than what we're eating. It should be coming from low saturated fat sources, from non-red meats, things like that. So I mean, I think we should be changing how we eat, we shouldn't necessarily be looking for the one thing that's going to save us. And now food is medicine. I think this has come up a lot lately. I think a lot of people eat or sort of ignore their patterns of how they eat and how they live their life up to the time that they develop disease. And then they want to change everything, right? You can argue you're not going to eat yourself out of disease. If you already developed the disease, you're not going to eat yourself out of it. In fact, you may actually harm yourself in the process. And so what I tell people is, that's great. I'm really happy you're changing your diet, and it may help decrease, when you present like this, it may help decrease your blockage, maybe a 1 step or maybe 2 steps, but it won't get you back to your normal self. In fact, all these prevention strategies that I mentioned, in my opinion, they probably work best up here in our teens and 20s, which is when we don't really care, right, about our diet, when we eat the worst. So it's really tough, and I tell patients, I definitely encourage patients to change the way they eat, because there's some evidence that you may decrease size of these plaques, but you're not gonna not need medications if you change your diet. So I think that's important. And we know that even with all this, with knowing all this, it still comes down to calories, right? I mean, this college nutrition professor showed that just eating Twinkies, he lost 27 pounds. I mean, I would hate to see what everything else looked like, but I mean, all he did was calorie restrict. And so weight loss is not a direct measurement of how healthy you are. I think you have to keep that in mind. There's unhealthy ways to lose weight. So for take-home points, calorie moderation, solid fats at room temperature are not good. And really, in general, what your mother or grandmother said was right. Too much of a good thing is bad. You have to eat everything in moderation. Eat your fruits and vegetables. Don't drink, or just don't drink too much. And a minute on the lips, lifetime on the hips. I think I heard that from my wife. So, I think I may have gone over it a little bit. So sorry about that. But thank you for your attention.